As the Affordable Care Act turned 6, here are 6 claims about the law that turned out to be false.
If you like your doctor, you will be able to keep your doctor, period. If you like your health care plan, you'll be able to keep your health care plan.
This was considered the #1 lie of the year in 2013, with PolitiFact finding at least 37 instances where President Obama made this promise to the American people. But as we all now know, that simply wasn't true. Millions of Americans had their policies canceled because their health care plans did not meet the new mandated provisions required under the law. And hundreds of thousands of Americans have lost the insurance they bought through Obamacare's public co-ops. So far, 12 of the 23 co-ops have failed, costing taxpayers $1.2 billion and forcing 740,000 people in 14 states to scramble to find new health insurance.
No family making less than $250,000 a year will see any form of tax increase.
Obamacare actually created 18 new tax hikes, totaling over $830 billion.
And that's why I've pledged that I will not sign health insurance reform as badly as I think it's necessary. I won't sign it if that reform adds even one dime to our deficit over the next decade. And I mean what I say.
Less than 4 years later, the Government Accountability Office announced Obamacare would increase the federal deficit by $6.2 trillion over the next 75 years. While there are varying opinions on what Obamacare will ultimately do to the deficit, we do know that its massive spending is very unlikely to be offset by huge Medicare cuts that might never happen and unpopular taxes on the middle class.
Once we have fully implemented, you're going to be able to buy insurance through a pool so that you can get the same good rates as a group that if you're an employee at a big company you can get right now, which means your premiums will go down.
Unfortunately, for many Americans, premiums did not go down. They went up, and the evidence suggests they will continue to rise. By 2025, the Congressional Budget Office predicts that employment-based coverage will cost about 60% more than it does today because of Obamacare.
No federal dollars will be used to fund abortions, and federal conscience laws will remain in place.
Actually, a report from the Government Accountability Office shows that Obamacare does in fact force taxpayers to subsidize bills for abortion services by simply ignoring strict regulations and laws put in place to prohibit it. The report shows more than 1,000 Obamacare insurance plans in different states do not separate funding for abortion services from coverage as required by the law. And federal conscience laws are being trampled. Just ask the Little Sisters of the Poor and other religious charities and schools who are facing millions of dollars in fines each year if they don't go along with Obamacare's mandate to include contraception services and products in their health plans that go against their faith.
Secretary Sebelius is a great secretary. Her implementation of this is fabulous.
Implementation of Obamacare's insurance exchanges was considered one of the biggest failures of 2014. Healthcare.gov only enrolled 6 Americans at the end of its first day and had massive online glitches that took months to address. And while the Obama administration claimed in 2014 that Healthcare.gov costs were around $800 million, an analysis by Bloomberg Government shows the actual cost to taxpayers was double that, at over $2 billion. And those are just 6 reasons Congress should blow out the birthday candles and repeal Obamacare once and for all.